Good morning. I'm Barbara Wilcox. I'm on day 2 of my second repair and I'm not wearing any glasses, as you can see. Dr. Gulani has generously taken some time out of his busy schedule to answer some questions. I'll let him explain what he did with my eye, if that's okay. And I'm just beyond words because Dr. Gulani, there's so many things I could say about him, but the list is so long. He is genuinely one of the kindest surgeons I've ever met in my life. And I have some questions here that he's offered to answer impromptu. I'm on a RK forum, and there's been lots of questions, and I told him I would ask him some today, and he's set some time aside. I'm gonna let him explain a lot more because I'm kind of nervous, but he is amazing. As you can see, I was told by all my other doctors it was impossible, and here I am 2 days after, and I can read these questions on my phone. And they're regular font, as you can see, so they're not big. So I just want to share this wonderful man. And there has been questions about us marketing for him. A few of us that have come to see him, Michelle, Steve, Mike, and we are not marketing. We're just sharing our experiences because he is amazing and he has changed our lives. So with that, Dr. Gulani, would you like to explain what you helped me with?
Mm-hmm. Sure. So great to meet you guys again. I'm indebted to my patients, and that's my power. To start with, we do not advertise at all. There are no deals here. There is no games. It is my true passion to help y'all, especially radial keratotomy patients, to fight for y'all and make y'all see. I've been teaching my colleagues, eye surgeons, eye doctors, optometrists all over the world for 3 decades, wanting everybody to fight for y'all, not give up. So, Bob, absolutely, I always have time for y'all. A lot of y'all come here in this, what I call it, my grilling sessions. After surgery, they sit down and they get to punch me. And yes, this is all impromptu, my amazing patients and their genuine feelings, and there is no script they're going by. So, Barb came to me like many and all. We had thousands of patients over the decades from practically every part of this planet who've come here, especially radial keratotomy complication cases, and thank God the results have been excellent. It cannot be guaranteed, the outcomes, and I'll explain to you why. And yet, what I want is every doctor should guarantee to themselves the commitment to fight for them, that shouldn't give up or do less than perfect job. So Barb came to me with radial keratotomy cuts with scars with high irregular astigmatism of the anterior cornea and posterior astigmatism with good tartar of the cornea, and additionally cataracts with extremely high farsightedness and astigmatism and reading issues called presbyopia. For such a patient, I do a procedure called LenzOplastique. These are proprietary techniques where I basically have a holistic viewpoint, where I don't just give a patient 1 or 2 options. In fact, I don't give options, remember? Among 40 different things I do, and unlimited applications of technology and implants, is how I come up with a holistic plan to correct everything in that patient's eye, no matter how complex it is. And we did her first eye, and how's that eye doing?
Awesome.
2020.
Perfect, yes. Perfect.
And now she's traveled back for her second eye, and though we saw her yesterday and she already are doing great because she's traveling home today, we're seeing her again. I love my patients before they leave. I love to meet up with them. So LenzOplastique is a technique where I use lens-based technologies to correct the abnormalities of the cornea without touching the cornea. So it's an optical correction over anatomical abnormalities. That's how I fool the brain to come into focus, despite the cuts on the cornea, if you can imagine that, right? And that's what Barb had. So in that, we also removed the early cataract as part of the LenzOplastique and place high definition lens implants that can correct the vision, at the same time give them the clarity and cancel off the irregular effects of the cornea, which, as you know, are permanent in you because your RK cuts were 95% deep. So they are going nowhere, but can we fool the optics and make you see despite that? That's what we did for you. Surgery took how long?
Probably by time, but probably not even 15 minutes. It was.
And she had surgery in our suite?
Yes.
No anesthesia?
No, just
numbing drops, please.
Numbing drops
for sure.
Yeah.
Any
was
pain?
Amazing. No, none.
So no IV, no injection, no needles, nothing, no stitches. It's a pleasure. That's why I have built the world's first eye surgical spa next door in our institute.
It's beautiful.
Where we do these surgeries, because I want everything to be focused around the patient. So they're not rushed. I'm never rushed, and everything is focused given how complex these cases are. So that's your case. So if you have cataracts, with your radial keratotomy, LenzOplastique is a technique that I proceed with.
Okay, and I have a few questions.
Sure.
My first one, I don't believe it's one on here, but everyone always asks about the amount of cuts. Can you let them know that doesn't matter? Can you explain why that doesn't matter maybe? Because that seems to be what everyone's stuck on in the forum with how many more cuts or how less cuts. And can you explain that?
Certainly. So this is not the patient's fault. It's a byproduct of many doctors looking at these cuts and, coming up with words that sounds scary to the patients, and then they go home with nothing can be done. Of course, more the cuts makes it more complex, but what is really more important in 3 decades of my having seen every kind of radial keratotomy and having fixed people with not only 30 cuts, but even 40 cuts RK successfully, I have seen that if the cuts are regular, straight, and perfect depth, sometimes a 20 cut is easier than a 4 cut cornea, which is irregularly cut. One is deep, one is shallow, open cuts with epithelial plugs, associated conditions like scars or fugues. So there are so many things to look at, not just the cuts. Yes, again, more the cuts, more difficult, but sometimes how the cuts are made. Again, with my experience having done so many corrections, when I enter these eyes is when I really get to feel what your RK surgeon felt 30 years ago. I get to see how flail your cornea is, how the cut is, which cut can open up, be careful in that area. All those things are vital. So don't get hung up on the cuts, but do get hung up on the desire to see despite your cuts.
Okay. All right. My first question from Dave. Does this correct halos and double vision? I can answer that. Yes. Yes. And I'm going out tonight with my sunglasses on to see if there's no halos on the lights. It's how awesome that is.
Again, for everybody on the forum, I'm blessed with the results I have, but as Barb will tell you, I'm also very firm in how patients have expectations with me. Yes, nearly majority of my patients are seeing 20/20 despite extremely complex radial keratotomy corneas, but that's not what I guarantee because it's very unpredictable. Here is why. There's a reason why most surgeons do not tackle RK problems because one, you're difficult to measure, remember? Second, you change, fluctuate a lot. And third, how does even anyone enter your eye where the cuts can basically break open because they were 95% deep? So these are the reasons most doctors have you wait till you're blind enough. I don't believe in that. So the real answer to this, Barb, I would like to break down into why is radial keratotomy difficult to predict? Number one is not just about vision. Think about it. The anatomy is very disturbed, nearly risky, disturbed to risky, right? Cuts all over.
Mm-hmm.
The optics are very distorted. You're looking through broken windshield. The refraction is inaccurate, meaning your glasses, numbers, or contacts is not accurate now. Machines also can't measure you accurately. Then you have lower order aberrations like very high astigmatisms, most likely farsightedness, cannot read, or nearsightedness. Higher order aberrations like halos, double vision, glare, all those kind of higher order aberrations. Then in addition to that, you can have associated corneal issues like scars from the RK, right? You may have Fuchs disease of the cornea. You may have ectasia, the cornea is bulging because of the cuts. All this makes it even more complex. In addition, you can have further other complications like you may have had cataract surgery somewhere which didn't work. Or someone did LASIK on your RK which obviously doesn't work. And those issues. Now when you put all this together, you'll understand that there is no normal RK patient. Every RK patient has these levels of issues: anatomical, optical, refractive, and aberrations. How do you do that? Now add to this constant changing going on. Yes. So in addition to the fact that you can't be measured and accurately measured, on top of that you're a moving target from morning to evening, you change. That's what makes it difficult. Then the anatomical challenge of how do you enter this eye and correct it. Given all that, yes, I am blessed. We've had results that so many of our patients have seen 20/20, but that's why I don't want it to be guaranteed. The guarantee should be the doctor's commitment to fight for you. What you are asking for is, Doc, please get in, get out, don't blind us, and help us see the best we can for the rest of our life. That is possible, correct?
It is.
Does that make sense, the long answer I gave just now?
Yes. In other words, we're all special. Every one of us.
And every eye.
And every eye.
Eye is special. Even in your case, one eye is different, your other eye had other different
Exactly.
cuts. Every RK eye is different.
He takes each person uniquely, goes in and studies so that when he goes and does your surgery, he has got it memorized in his mind what he wants to do. Did I get that? Because you do not rest until it's amazing.
I have a problem. Perfectionism is a disease.
Well, I'm glad you're a perfectionist.
So my whole thing is, guys, what I teach doctors is your complexity. The patient's complexity should not decrease the doctor's desire to still strive for perfection. That's important.
Okay, my next question. This is a good one because a lot of us have been told this by our eye doctors. If someone has early cataract, should they wait until later? This gentleman that did this, he's 48, so
Sure,
he's thinking
sure.
of himself right now.
Never. First of all, let me clarify this concept for you. What is a cataract? The cloudiness of your natural crystalline lens in the eye is called a cataract. Like the graying of our hair. Graying of the hair is one thing. Going completely white hair is totally different. No, you don't have to wait. Here is why. Don't even call it a cataract. All right? I call this, by the time RK people arrive to doctors, they're usually over 40 years of age. One, because they had it in their
Right.
25, 30 years
Right,
ago.
exactly.
Second, now they're affected because the RK has made you farsighted, so you can't read because by 40 you are presbyopic. Remember, you need reading glasses. So now you're doubly affected and you come running to your eye doctors. Given that at that age, especially if you're over 50, your lens is also slightly cloudy in the eye, right, with age. And that's how you realize at nighttime you have more difficulty driving and you need more light in the restaurant despite your reading glasses. You know your lens is one of the impact. Of course, we do the entire advanced diagnostics and pick up the densitometry of the lens. So as long as your lens is not one of the criminals in this vision issues or factors involved, you can leave it alone. But if it is cloudy and one more factor among your poor distance and near vision and astigmatism and ectasias and scar, get rid of that too during the surgery. In fact, LenzOplastique is based on that principle of how not to leave any culprit inside the eye. Otherwise, if you're less than 50 years of age and you have vision errors, I do laser plastic on the cornea, where over your cuts, I do my laser without cutting. No LASIK, please. Remember, I don't like LASIK on RK because LASIK cuts in the opposite direction. RK was cut vertically, it disrupts the cornea. But laser plastic is a smooth shaping without cutting. I call that new carpet on broken tiles. And you can see through. But if your lens is involved and you're over 50, LenzOplastique is the way I would suggest. And also, you're done forever because you won't have a cataract anymore. It is a more invasive surgery. Again, invasive meaning 10, 15 minutes, but more invasive than laser plastic. And we do that one eye at a time as opposed to laser plastic, but that's the way to go. So no, there is no need to wait for anything. See if your lens is one of the culprits of the visual system. That's the whole part about designing. You don't want a doctor who knows 1 and 2 technique and is avoiding something.
Right.
You want someone who's designing for you. And then if your lens is part of the system, it needs to move out. Does that make sense?
Yes, it does. Okay. Okay, what are the risks associated with this procedure? All surgeries have risks. So what's the risk?
And I give you a one word answer: blindness. That way you are serious about what this really is. So no, thank God we've never had anyone. Hope I never have anyone with that issue, but it's possible. Remember what I told you, RK corneas are cut 95% deep. If it breaks open, it's over. You need a full transplant and a fully damaged eye. If anything happens in the eye, bleeding, your cataract doesn't come out, it falls back because you're actually a very long eye. Remember, you were very nearsighted before RK. You became farsighted because your cornea flattened, right? So you still have a chance of retinal detachment. All those things can happen. As long as you understand that seriousness, it's important. In fact, this is more a question, Bob. I would talk more to surgeons about this. I say, be very careful. Don't be a cowboy and go inside the eye. Plan. Even after I've done, I don't know anyone else who's produced these results, but even today when I go into any of these eyes, I'm intensely prepared I have all my technology. And yes, it's a challenge. But once you're committed, perform.
Okay. All right. Now, I don't know. This is going to be too long of a question. Of an answer, I mean. How did you get into treating RK patients?
As you know me, Barb, to me, no one is routine. So to me, it doesn't matter if you had RK or a hex K or a LASIK complication or a smile complication or whatever. You're an eye that deserves to see. So every patient I see in my institute, even when some patients come in for like simple LASIK, to me, even those I look at intensely. You've seen the way I examine y'all.
Right.
I mean, it's days of measuring
Yes,
y'all.
very much so.
And intense. So to me, fashion designing is my other passion. So
as you can tell.
To me, really, I feel it's not only a disservice, I even call it a crime that if someone is not designing your vision and giving you less than optimal, it's not right. So to me, RK is just one among all the complications that are flown to me. Patients who had bad cataract surgery, bad LASIK surgery, bad keratoconus surgery, bad scar surgeries. All these patients, I look at it as, do you have vision potential in the brain, the computer? If you do, it is my duty now to work through this optical system using 40 different techniques that I do with unlimited technologies that I have, and how do I make the brain see? So RK is one among these that I fix. I don't get fixated to who was your surgeon, what surgery was done, what blade was used. It doesn't matter. Look at the broken camera, use your 30 years of knowledge and go, this is how I'm going to make this camera work. So simple.
So we were fortunate that RK happened to be in your group of basket of skills, I guess. That we were fortunate that you came along.
Well, I'm fortunate. I've
you're
been privileged because, like I said, all of you who come here to me, it's very personal for me. I know the name of thousands of my patients all over. It's vital. I want medicine to be practiced this way. I want none of you to be sitting and without hope.
Without reading your phone.
Don't read.
And one more question, and then we'll tie it up. Because I know you've got patients waiting.
Sure.
Do you only do surgery, or will you do a detailed refraction for glasses, even though refractions are hard to get correct?
So we don't do glasses here at all, but I do refract y'all surgically. There are various methods I use, and all this is on my website, and we've talked about this all over the world. I measure you in a way that I'm looking for every drop the brain has. What I say to you, like Barb, you remember I told you, your eyes are in my way, I'm after your brain. Right?
Is it good luck?
So you said that. So really, to me, vision is a brain function. Don't forget that. Your eyes don't see. Your eyes just collect data. And they give it to the brain to formulate it. I take advantage of that knowledge. And of course, I have to surgically still perform perfection. Otherwise, the brain will not register what I'm trying to do. Also, this other question you haven't asked me, Barb, that many patients come here, that doctors are giving them options of 3 lens options for cataract with RK. Platinum, gold, and garbage package. I'm like, that's not right. That you should never get a menu card. You must meet a master chef who can design the recipe for you. So there are actually over 30 lens implant options in the United States. Over 80 worldwide, because I travel, I teach abroad, and I do things abroad too. So don't settle for choices and options. You should have a plan, and why that plan should be clarity. Other question you'd asked me, Barb, before, that there are doctors who call themselves specialists in these RK corrections. Well, based on what Amanda requested and y'all had some time back, I wrote for y'all what to look for in a doctor. First of all, meet the doctor, please. Look into their eyes, look for genuine, look for track record. Do not fall for advertising, and absolutely don't fall for any deals. As I keep saying, blindness at any deal is not a great bargain.
Exactly.
Right? Please, I'm human. I can make a mistake. My point is, did you try? Did you try for perfection? So do not fall for this lens implant, that lens implant. Lens implant is just an ingredient. If your recipe is wrong, doesn't matter what you put into that coffee or your curry. It doesn't taste good. So a lot of my practice, over 70% of my practice, is fixing patients who've had bad cataract surgery, wrong implants and stuff with the RK. So it's very vital, please. Don't fall for these things. I've given you all criteria. Ask the doctor what makes them an expert. Who else besides their family thinks they are experts? Second, where do they teach on this planet, not just outside their office in some restaurant? 3, which surgeons Do surgeons, other eye surgeons, refer their problems to anarchic problems to them? 4, do they have skills of laserplastic, corneoplastic, and LenzOplastique, and the whole channel of technology available? Because only then can you have a design surgery, correct? Sometimes you need combined techniques. So these are such simple questions. Meet the doctor. I'm absolutely sure no doctor would ever want to harm any patient. All your doctors do their best they can, but it is still your due diligence. Ask these questions. Don't fall for advertising. Don't fall for any gimmicks. Meet the doctor and go, here is my situation. Here is my expectation. Please let me know how you can help me. And can I have some proof? If they have 1 or 2 patients only talking, ask to see at least 1,000 patients. Ask to see patients from all over the world, not just some one geography where maybe one doctor is referring to each other. This is just ways of empowering patients. For eye surgeons and eye doctors and optometrists, all I say is believe that these patients, no matter how bad their RK looks, they can see through it. So it is our duty to restore that vision, bring them out of the lion's cage. Very important. As I say, and I'll end it with that, Barbara, my statement on stage, a doctor's inability should not become a patient's disability.
That's good. I like that.
That's all, Barbara.
All right.
Safe travels.
Thank you.
No more
Dr.
screens.
Gulani. And you do this. Of course, I gotta do 2 thumbs up.
Love you guys. Love you.
Thank you.